Hello everybody and welcome to the Thursday edition of Video Clips. I've got a couple of interesting topics to cover here, starting with sleep. Getting a good night's sleep can be challenging for some people. Prescription and over-the-counter sleep aids are billion-dollar sellers, and I always gauge how much a disease has become prevalent in our population by the drug ads on TV. I don't think you can watch television for an hour without seeing at least one ad for either something for your GI tract or a sleep aid. The problem with using drugs for sleep is really the same as the problem as using drugs for any condition, which is that at best you mitigate symptoms, but you don't address the underlying cause. And of course, there are side effects. In the case of sleep drugs, you also have the added potential for addiction. Research shows that cognitive therapy and sleep restriction are both more effective than drugs for long-term resolution of sleep issues. Now, sleep restriction involves spending time in bed only when sleeping, getting out of bed when you can't sleep, and doing other things until you become exhausted enough to sleep for a prescribed period of time. Cognitive behavioral therapy, or CBT, is a form of therapy that is highly effective for treating a lot of different conditions: depression, ADHD, anxiety, and sleep disorders. The CBT approach to sleep involves a combination of sleep restriction, guided imagery. As with all effective protocols, there are several things involved. In one study, 160 adults with insomnia were randomized to engage in cognitive behavioral therapy, or CBT, or a combination of CBT with 10 milligrams a day of Ambien. Now, during the first 6 weeks of follow-up, the group that was getting the drug and CBT together actually was doing better, but by the end of 6 months, the CBT-only group was doing significantly better. And lead author Charles Morin told the New York Times, quote, and I think this pertains to any drug actually, it says, "In the short run, medication is helpful, but in the long run, people need to change their actual sleep habits. That's what CBT helps them do." So in the short range, drugs are very effective. That's part of the appeal. Instantaneous resolution to your problem. In the long term, not so effective, and then of course the side effects and all that sort of thing. Therapy and sleep restriction are admittedly more difficult. That's another problem with drugs. In addition to the appeal of having your problem solved instantaneously, the alternative is more work, which makes some people choose drugs. But sleep restriction and cognitive therapy much better in the long term, as the study shows. Now, without a therapist, you can try sleep restriction and retraining on your own at home. Here's how it works. You go to bed at your usual time, and if you can't sleep, you get out of bed and do other things. I mean, clean your house, work, read, whatever. When you're tired enough, go back to bed, and if you don't fall asleep, get up and repeat. Eventually, if you do this and you only stay in the bed when you're sleeping, you might have some sleepless nights, but you will eventually become exhausted enough to start sleeping through the night. I say this kind of tongue-in-cheek, but for a lot of people who've been through this, they'll say, it's amazing. My cupboards are cleaned out, my closets are cleaned out, I've taken all my old clothes to Goodwill, and I finished the basement, all while I was retraining myself to sleep. Now, the same strategy applies to waking early. If you wake up really early in the morning, get up and start your day. Don't toss and turn and that sort of thing. Force yourself to avoid napping and wait until bedtime to go to sleep. So whether you're waking up early or waking up intermittently throughout the night, the whole idea is that you only are in the bed when you're sleeping. And eventually you'll train yourself to sleep. And another byproduct of this is you won't feel so anxious about going to sleep as you begin to gain confidence in the fact that you will go to sleep and stay to sleep. Anxiety about sleep issues is one of the things that worsens them. Oh my gosh, it's 10:30, soon I'm going to have to go to bed, and I'm not going to be able to sleep, and then I'm going to toss and turn, I'm going to be tired in the morning. So the anxiety about all of that will go away too, and you end up with a permanent fix. All right. The next thing I want to talk about, really interesting. I ended up spending a lot more time tracking some things down than I intended to. This article, all of these, by the way, are posted in the HealthBrace library. This one has 8 references. And it deals with proton pump inhibitors, or PPIs, which are included in the list of the top 10 most widely taken drugs in the world. I mean, I think I read something, it was something like 16 million prescriptions in the United States alone last year. They're prescribed to reduce gastric acid production in patients who suffer with reflux or GERD. In addition to being prescribed by doctors, PPIs are available over the counter. Two of the most popular that you, I'm sure, have heard of are Prilosec OTC and Prevacid. Now, PPIs, like all drugs, don't address the underlying condition. We were just talking about that with sleep disorders. And the underlying condition reasons for reflux have to do with diet, health status, and weight. Advertisements for the drugs, and it just makes me sick when I see this, show people taking their PPIs and eating fried chicken and ribs and other unhealthy foods, and the image or the message that's being conveyed is you can eat all the unhealthy foods you want, all you have to do is take PPIs before you have these foods and everything will be fine. That's not true. Even worse is that, in addition to not being true, the drugs themselves cause side effects, and one of them is an increased risk of intestinal infections, especially C. diff, which is difficult to treat and can even result in death. And it used to be that people only got C. diff in the hospital, and in the most recent years we've seen the big increase in the incidence of C. diff in people living in the suburbs of Columbus. So how is that happening? It's happening because the drugs cause changes, PPIs cause changes in the gut microbiome. In one study, researchers assessed the gut microbiome of over 1,800 people, some of whom were healthy and some of whom had gastrointestinal disorders. And the subjects reported their medication use. They provided stool samples for analysis. 211 patients reported taking a PPI, and those who did had less bacterial diversity. Those who were taking the PPI also showed increased colonies of several pathogenic bacteria in the GI tract, including E. coli. Quote, the differences between PPI users and non-users observed in this study are consistently associated with changes toward a less healthy gut microbiome, the researchers concluded. These differences are in line with known changes that predispose to C. diff infections and could potentially explain the increased risk of enteric infections in PPI users. They state that for the general population, the negative effects of PPIs are even more profound than those associated with taking antibiotics and many other commonly used drugs. And I've talked about this a lot. I think the fact that these drugs are available over the counter, in addition to the ads promoting them, promoting their use by people who are having fun, and aren't you amazed that some of these commercials make it seem like it's really fun to be sick? You almost want to join the party, right? Well, there's an even darker side. Another side effect resulting from PPI use is hypomagnesemia, which usually results in hospitalization. And studies show that trying to take magnesium supplements while you're taking a PPI doesn't really lower the risk. And what's really difficult is that doctors have been unable to identify any pattern that tells you that certain types of patients are likely to have this happen to them. The FDA actually issued an alert concerning the risk of dangerously low magnesium levels in 2002. There's some debate about what the mechanism is that causes magnesium deficiency, but magnesium, like most nutrients, is absorbed in the small intestine, and it may be that the negative changes in the gut microbiome that were identified in the study that I just discussed are responsible, since one of the functions of those bacteria is to facilitate absorption of nutrients from food, which would include magnesium. PPIs increase the risk of malignant esophageal cancers, which used to be uncommon but have increased significantly as the use of PPIs have increased. PPIs reduce stomach acid, that's the whole purpose for the drug, but as a result, pancreatic enzymes that should have been inactivated by that stomach acid are able to damage tissue in the esophagus. The irony, I think, has to be noted. PPIs are prescribed to treat reflux because patients are told reflux increases the risk of esophageal cancer. If you don't treat it, the treatment, in this case PPIs, in turn increases the risk of esophageal cancer. And that's not uncommon, by the way. Drugs taken to treat a certain condition actually have an increased risk of developing that particular condition. An even more important issue, and this is what I found very fascinating, that should reduce a whole lot of enthusiasm for all of the classes of drugs that are used to treat reflux, is that research is showing that the cause of it may have been misunderstood. Instead of resulting from the release of gastric acid burning the mucosa of the esophagus, GERD stimulates the release of inflammatory cytokines from esophageal cells, which attracts more inflammatory cells to the esophagus. This inflammation and subsequent change to the submucosal tissue may be the cause of heartburn and chest pain. Well, if this is true, the current approach to treating GERD can relieve symptoms, but it will not improve at all the long-term prognosis for patients who have reflux. You'll get rid of the symptoms of burning that are associated with the injury to that top-level mucosa, but the damage to the lower-level mucosa will continue even if no acid is getting into the esophageal tube. Now, the causes of reflux are well documented and understood, and they include things like eating a high-fat diet, overeating, constipation, and obesity. So adopting a low-fat, plant-based diet, losing weight relieves the symptoms, and that's what most people want to have relieved right away, but also addresses the underlying condition for most people with no negative side effects. So PPIs, really bad idea. Not only because of the direct side effects, but because they actually can increase the risk of esophageal cancer. That doesn't mean that other types of treatments for reflux are better, because as it turns out, treating the reflux really doesn't reduce your risk of esophageal cancer. As always, getting to the bottom of the issue is what reduces your risk. All right, well, that's all for today and actually for the week. As always, pass this on to anybody who you think might enjoy watching it, and I'll be back to you next week with more news.